In today's society, in today's modern world, health and the ability to access any sort of health and doctors is crucial, and it's up there with oxygen and water and basic needs, basic human needs. After all, we're certainly not a third world country, and our health system should not display when we have the ability to help someone, we should help them regardless of money or anything. In my day-to-day role, speaking up in regards to patients or representing patients is vitally important. In my role as an anaesthetic nurse, it's just prior to a patient going in for a procedure or an operation, and this is the time where patients are certainly anxious. I mean, let's face it, you've got their life in your hands under anaesthetic, whether they know that or not. And it's a time that the patients, they're not thinking about the big picture and what's going on and this sort of thing, and you have to calm them down, reassure them. You have to ask them, are there any queries, are there any problems that may be of a concern to themselves before the procedure? Is there something that the doctor hasn't told them? Is there consent forms that need to be signed? And just reassuring them that everything is going to be fine, that they're in safe hands, and also experienced hands, I guess, is very, very important. Just to deal with the patients in this time that they're at their most vulnerable is certainly, it's all about the patient and being the voice for the patient before they go under anaesthetic. Doing anaesthetics, you have a window of 5 to 10 minutes to meet and greet the patient, and in this time you have to develop a trust and a rapport with the patient in this very specific environment in which the patient certainly, they're scared, they don't know what's going on. They know they've got to have a procedure done, but in some instances, and in most instances, the patients haven't had procedures done before, and it's my role to keep them calm, let them know what's going on, what's happening, what my job is. Also to liaise with the patients and the doctors to ensure that any questions, any queries they have about the procedure that's about to happen to them is exactly to their understanding. And this is a very valuable part of the actual nursing role that I do. Part of my role is to ensure that the anaesthetic machines are ready for the day's use for the operations. Also to ensure that the setups for each individual patient and each individual anaesthetist, depending on whom I'm working with, is all ready to go, and depending on what operation, what procedures that we're doing across the day, could be 8 hours, could be 10 hours, could be whatever. It's all ready to go, and anything that the anaesthetist requires, that's my job to get that. Any equipment, anything during the day, as well as maintaining patient safety.